Hi everyone and welcome to our Professional Studies presentation. Our presentation describes the journey of two professionals who have been working in their area for over 10 years. Throughout this we will discuss our interviews with two professionals focusing on three main theoretical concepts.
These concepts are professional identity, which is described as one's self-concept based on attributes, beliefs, values and experiences. Threshold concepts, which are learning experiences that when passed through create a new perspective which changes a person's way of thinking or doing. It cannot be unlearned. And vicarious trauma, which will be defined later in the presentation.
For the purpose of this presentation, pseudonyms shall be used and we shall refer to the professionals as John and Mary. John is a staff nurse in the intellectual disability sector and works in a residential service. Mary is a youth work coordinator in a rural youth club setting and is also involved in community development work in her local area.
John's first job after leaving school was working as a plasterer, but the downturn in construction forced him to look elsewhere for employment. He took work as a care assistant in the intellectual disability service. He initially planned to work for just the winter, but ended up staying for 7 years. Following the encouragement of the ward sister, he applied for intellectual disability nursing studies. John has climbed the ladder in his sector and is currently working as a staff nurse on nights in an intellectual disability sector on one of the challenging behaviour units. John noted that at the minute in his profession, as well as providing care for the service users, there is a focus on deinstitutionalisation and the documentation associated with the transition to community-based living. According to John, his training instilled him with the knowledge of what it means to be professional from day one. Nursing has long been recognised as a well-respected profession. He questioned what it actually was to be professional, with his personal opinion being that people judge a book by its cover. He was taught that it is about the job you do and not how you dress that is the important factor in professional identity.
Mary has a Bachelor of Arts honours degree in Applied Social Studies. She has always had an interest in helping young people and the dynamics of community development. Her experience of good community spirit in her locality also heightened her interest in the area of social care. Mary started working part-time in the youth club after completing her third-year placement there. Once she completed her studies, she was offered a full-time position in the youth club. She has continued to work there for the past 10 years and has since been promoted to youth coordinator. Mary continues to engage in various training opportunities, which allows her to keep up to date and upskill. Mary feels her role as a youth worker is not recognised as a professional role. She believes there is no real recognition for the level of work they undertake. She describes how their workload has significantly increased recently, but staff have suffered pay cuts and uncertainty in their future. Mary sees herself as a professional, but acknowledges that others outside the sector do not view her role in that way.
When comparing both views of professional identity, it became evident that nursing has always been recognised as a profession, whereas Mary and others like her continue to fight for the same recognition. However, in the current climate, there has been a role reversal. ID nursing as a profession is terminating, while the establishment of CORU means that social care professionals are finally getting the professional credit they deserve. With the emergence of HICWA has come an increase in paperwork. Previously, service users could be taken off campus to events like football matches or concerts. Currently, social activities carried out must be risk assessed by a professional. This has had a knock-on effect on activities that were previously taken for granted, which has resulted in fewer social outings for service users.
Mary described how the introduction of new policies and procedures, especially with regard to child protection and Garda vetting, has altered her role. Organising day trips for members of the youth club or attending social activities outside the club itself has many risks, and therefore the amount of paperwork required to organise these means that unfortunately these trips do not happen. Mary and John realised that although they did not receive any training with regard to the recent substantial changes in procedures, it has been a gradual learning process that has changed the way they perform their roles. The above examples could be described as troublesome threshold concepts, as the process was conceptually difficult to grasp. The process of change was gradual and unconscious, but is now part of their everyday role.
Vicarious trauma occurs when we are affected by the experience and traumatic stories of survivors of trauma. In some professions, it is viewed as cumulative, inevitable, and normal. Burnout and vicarious trauma often go hand in hand. Burnout symptoms can include apathy, irritability, exhaustion, and an uncaring attitude towards service users. John feels he has never experienced this due to the training he received. It taught him not to become emotionally attached to the service user and also highlighted care of self as an important factor in the profession. By doing this, the situation should not get to you. He also contributes that most of the service users he works with have not experienced the type of trauma associated with vicarious trauma.
Mary suggested that there is a high rate of burnout in her work as she is dealing with intense issues. She recalled one situation where a member of the youth club suffered the loss of a parent to suicide. He found life very difficult afterwards and attempted to take his own life. There was a high level of dependence on Mary, which resulted in her experiencing loss of appetite, lack of sleep, and an increase in stress and anxiety.
Both professionals identified debriefing as an important preventative and supportive measure in dealing with certain issues. In Mary's experience, debriefing provided a safe environment for her to discuss the challenges she was facing, which has reduced feelings of stress and anxiety in her role.
John and Mary recognised that there was little time given to report writing during their training. With an increasing emphasis on documentation, this is something that would have been extremely beneficial. John wished that his training was more varied. His training focused on children with intellectual disabilities. However, with an ageing service user group, staff have little or no knowledge of the development associated with ageing.
In conclusion, after reviewing both interviews and discussing the information, many similarities became evident. This surprised us both as John and Mary come from very different professions. Both recognise that professional identity is about your work ethic, threshold concepts are inevitable, and vicarious trauma can be prevented through practicing self-care.
Thank you for listening to our presentation. If you have any questions, please feel free to ask. Thank you.